Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist from Houston, Texas. Been practicing cardiology for more than 40 years. The feature presentation today is Medicare Advantage plans and prior authorization denials and their effects on Medicare patients' welfare and outcomes. We have some interesting data and recommendations, so please do watch it till the end of the presentation, and please do subscribe to our YouTube channel and press the like button. Let us begin with the feature presentation. As a cardiologist, let's say for example I see a patient with chest pain. After evaluation, I recommend a nuclear stress test. Since the patient belongs to a Medicare Advantage plan, whether it's an HMO or a PPO, they need to get prior authorization. That's where the real challenge and the story begins. First of all, let us understand which insurance companies are we talking about. This is primarily focused on the Medicare Advantage plans, which is a sort of a private insurance company's subsidy of the Medicare program, where the Medicare is administered by these private insurance companies like Humana, Aetna, United Healthcare, Cigna, and a whole bunch of other ones for a fixed fee. But the challenge that we face is that with all these managed care plans, you have to have a prior authorization to get a nuclear stress test or a CT or an MRI or any outpatient procedures. And that's where the real trouble begins. As I said, you need a nuclear stress test. I ordered the nuclear stress test, and now we have the Medicare Advantage plan saying that we have to have prior authorization. They need to review the patient's records. They need to look at the indications for the test. They need to look at the guidelines set by Medicare, guidelines set by their own within their company, and then see if you meet all these criteria. And this is what I call the 8,000-pound brick wall. Because if you have ever been a Medicare patient, or if you are a physician like me who is dealing with Medicare patients, we see this challenge on a daily basis. It is time consuming and it is counterproductive, and it may deny or delay the procedure and could lead to more adverse outcomes, as we will show some data. So 13% of all claims for tests or procedures were denied by the Medicare Advantage organizations, which I just talked to you about. Who is supposed to oversee this Medicare Advantage organizations or the insurance companies that are supposed to be following the guidelines set by Medicare for any type of a test or a procedure or a surgery based on evidence-based criteria? But that is well said and done. It is the Office of Inspector General that oversees the welfare of the Medicare patients. Don't get me wrong, I'm licensed insurance agent in Texas, so I can speak on both sides of the aisle. There are 38 million people all across the United States who are enrolled in Medicare Advantage plans. The Medicare Advantage plans do play a role in reducing the cost and make things affordable for people on fixed income Medicare patients. However, the Medicare Advantage plans, all of them have prior authorization for almost every procedure or surgery that you need. Then we have the Texas Insurance Commission, which also monitors the activities of the Medicare Advantage plans, which are controlled, which are registered with the Texas Insurance Commission. The Texas Medical Association, which advocates on behalf of the physicians, has very little to say with the Medicare Advantage organizations because they don't have a direct connection with them, but they can talk to the state representatives to introduce new laws that protect the patients, namely the Medicare recipients. That is the main purpose. American Medical Association, which is the overall umbrella for physicians all across the United States, did a study in 2020 looking at the adverse outcomes of denial or delayed prior authorizations for Medicare Advantage plan patients, mainly the Medicare patients. They did a survey. The respondents said that controversial insurance practice has 94% delayed necessary procedures. So there is a consistent delay. The moment that you need an authorization, there's going to be a delay because, first of all, your physician's office has to call the insurance company or get on the computer and enter a whole bunch of data. That has to be reviewed by the nurse on the other side with the Advantage plan company, and that has to be approved. If she feels not confident, then this has to go to the medical director and they have to look at all the criteria, and so there's going to be a delay continuously added on at each level. Delayed necessary procedure in 79% of the patients. 30% of them had to abandon the treatment because of the delay, because they couldn't wait. Not that they didn't need it, but they couldn't wait because maybe their condition got worse, which might have forced them to go to the hospital. The insurance companies tag on additional criteria beyond what Medicare has set for a particular test or a surgery or a procedure. So all these additional criteria, which are not approved by Medicare, are used by insurance companies internally to reduce the number of claims approved, and that accounts to almost 30% of the cases. Created a serious adverse event in 20%. 1 out of 5 Medicare recipient who is getting a prior authorization, who is denied, has an adverse event. That's a significant number. If if 5 people are sitting in your office and you apply for her prior authorization and one of them is denied the procedure, it may not seem like a big number, but when you add up the entire population of the United States, it is going to be quite substantial. And as a matter of fact, 18% of them ended up in the hospital. So if you can get a CT as an outpatient, if you can get an MRI as an outpatient for a cost which is infinitely minor, then you end up going to the emergency room, getting emergency evaluation, emergency CAT scan, emergency MRI, which can double, triple, or quadruple the cost of the same procedure if it had been approved in a timely manner. So it is increasing the cost of healthcare, which is going to be passed on to the consumers at the end because the insurance companies are there to make profit. So this is from the American Medical Association. Now let's look at the Office of Inspector General study, which looked at 430 combined prior authorization and payment denials by the Medicare Advantage organizations. Just 1 week, they looked at January 1st to January 7th in 2019, and their results were not surprising. Out of the 12,300 estimated prior authorization denials, a projected 1,631 of these service denials met the Medicare guidelines. If these patients had the traditional Medicare, the Medicare Part A, Medicare Part B supplemental insurance prescription plan, the Cadillac plan, I would say, then they did not need authorization and their requests were directed by Medicare guidelines and it would have been automatically approved. So 13% got an unnecessary denial, and that can be pretty serious in in a patient who needs urgent medical evaluation and treatment. It's not doesn't stop right there. And as I said, 13% of the prior authorizations denials delayed the procedure unnecessarily and the care. If the same number of patients were denied every week for the entire year, the OIG estimated 85,000 denials despite coverage rules set by the Medicare itself. Here's another study that looked at and found that 18% of more than 160 estimated payment denials met both Medicare coverage and MAO rules and should have been approved by the Medicare Advantage organizations. That annually report projects to 1.5 million requests denied. And as I said, there are 38 million people who are enrolled in various types of Medicare Advantage plans, be it HMO, PPO, or point of service, or fee for service. It doesn't matter because 1.5 million, that's almost like more than 3% of the Medicare Advantage population getting denied unnecessarily. That can adversely affect their health, their well-being, and their medical costs. The most important thing is the Medicare Advantage organizations were using criteria that were not even set by the Medicare itself, using their own internal criteria just to deny claims. I have no idea what their intentions are, but they were using that, which were probably not based on evidence-based medicine. In addition to using extra criteria over and above what Medicare set, the Medicare Advantage plan, the payment denials and approval denials were also related to human errors in handling evaluations, claims, system errors due to computer glitches, outdated softwares. So based on all this, the Office of Inspector General issued certain guidelines. They issued guidelines for Medicare Advantage organizations to update their criteria to be consistent with the rules set by the Medicare patients who are on traditional Medicare. Update their audit protocols to address problems related to report identification, and also train their staff to reduce human error. They also addressed them to update their information system to be compliant with the Medicare guidelines. This report was submitted to the CMS, which is the National Medicare Clearinghouse, and the CMS accepted the report. Here in Texas, the Texas legislature introduced a bill called House Bill HB 3459, which states that if you as a physician have a continuous approval rating of more than 90% on a given test or a procedure over 6 months period, then you do not need to get prior authorization for the same procedure until that status is changed. And it also applied to the Teachers Retirement System of Texas and Employees Retirement System of Texas. So Texas has taken very aggressive, proactive steps in protecting the Medicare recipients, the recipients of the Medicare Advantage plans, so that they are not unnecessarily denied or delayed with reference to any tests or procedures they need. So, ladies and gentlemen, in conclusion, what can you do if you are on a limited income resource and you're on a Medicare Advantage plan and your doctor recommends a particular test, surgery, or a procedure, and your Medicare Advantage plan denies the procedure or delays the procedure? Here are some of the steps you can take. First, you file a complaint with the grievance department of your insurance company. Number two, You can report this to the Office of Inspector General. You just go to the OIG site. There you can file a complaint. You can also file a complaint with the State Insurance Commission, which oversees all health insurance carriers in your state. So hopefully that should resolve the issue. But if this issue continues to be a problem, then it is time to talk to your state representatives to introduce bills that protect you as the recipient of Medicare Advantage plans so that you're not taken for a ride on your limited income when you desperately need a test or a surgical procedure. Ladies and gentlemen, thank you so much for watching this presentation. I am Dr. Nik Nikam from Triple N Media, and please do subscribe to our YouTube channel, and I will see you in the next video. We have several videos with reference to senior care, Medicare Advantage plans A, B, C, D, and all the things that you need to know about how to enroll in Medicare Part A, Part B, Social Security, and much more. Thank you so much.